Hi, I'm Don Pearson with Arizona AFO. I know what you want. You want a brace from us that's going to fit perfect. One you can put on your patient, they love it, nothing rubs on them, anything, they're able to go and they're happy with it. That's what we want too. So the purpose of this DVD is to show you how to obtain a good cast that's going to enable us to make the brace right the first time for you so you won't have any problems. This is the cast that you're going to see me take actually in this DVD of my assistant. Now, she didn't have foot problems, so maybe it was easy. But I just want to be able to show you this is what we're looking for. A cast that's in a neutral position, nice and smooth, well marked, etc. But I'm going to show you some casts we received today actually and show you what we consider a bad cast. Alright? The first one here is this plaster cast. It's not high enough, it's open, so that leaves some room for us to guess on the anatomy. The heel's not in alignment, it's plantar flexed. It's really hard for us to take a cast that's like this and to make a good brace from it that's going to fit properly. Here's another example. This is very plantar flexed. You can see the alignment of the heel, how all this is of the forefoot. You know, they marked on the order form for us to adjust this to neutral. It's hard to do. We lose a lot of the patient's anatomy when we go and cut this and adjust it up. So if you could get one this more in a neutral position, it's going to be wonderful. This is really going to be very difficult for us to make a brace that's going to fit properly. This third one, take a look at this. In the DVD it shows how to ship one of these. You take your time, maybe pack it with a little bit of paper, be careful how it's packed. This is totally deformed, and they're wanting us to make a brace from this. A little bit of a challenge. So if you could just take your time and make sure you get us a cast that's somewhat similar, to this, we'll be very happy, you'll be happy, and most importantly, your patient's going to be very happy then with the fit and function of the brace. So please follow the instructions on the DVD. Let us know if you have any questions. Thank you. We offer a casting kit that is available to you for your use. Included in this kit are the following items. First of all, there's the foot board. This board emulates the heel height of a shoe, so that when the brace is placed inside the shoe, it's at 90 degrees to the floor. So there's about a 3/8-inch differential between the height of the heel and the ball of the foot. We mark it heel and toe. That's how the patient's foot should be placed upon the board. It's like that. Okay? Next is a flexible strip, and this is a protective strip that you tape onto the patient's leg first. You'll be cutting against this with scissors, so it's just to protect their skin in case there'd be a problem there. On top of this strip is a flexible tube that fits on like this, and you also tape that on. This is just some plastic tubing. It's readily available. You can use this time and time again. So the plastic tube comes with it. An indelible ink pencil. You have to sharpen it first to use it. But you can use that to mark your cast or any of the bony landmarks, etc. A pair of the STS scissors that are small and they're angled so that once you start cutting up the cast you can easily remove it from the patient's leg. There's 2 plastic bags that come with this, and this is the bags that go on the patient's leg first before you would apply the STS socks, which 2 of those come with the casting kit. Normally we use the 17-inch size medium. That fits about 90% of the population. So you get 2 socks with the bags, all the extras, and of course a DVD that's going to show you can review to see how the cast is properly taken. There are a couple of items that are not included in the casting kit that you will need. One is a plastic tub or a bucket, something like this, in order to put your water in. You'll need that. You'll need some tape, either cloth tape or a nylon tape, in order to tape on the cut-off strips. Some rubber bands just to wrap around the cast when it's done so it'll maintain its shape. And of course you'll need some gloves to wear to protect yourself from the casting material and during the casting procedure. Other than that, that's all that you'd need to be able to take a good cast of your patient. Okay, I'm going to take our casting footboard and place it inside of a plastic bag just to protect it from the casting material so it doesn't get sticky. I'm going to place this on here and take the patient's foot and place it on the board like that. Then I'm going to make sure as far as the patient's range of motion goes. Do they have range of motion as far as dorsiplantar angle goes? Can they flex their knee to fit on the board to attain a neutral position? Also varus valgus of the forefoot and of the heel. And just check the overall range of motion, see where there's pain at, and how the patient can be comfortably held in a neutral position. Once that's achieved, we're going to set it on the board and look for a 90-degree angle with the hip, knee, and ankle all at 90 degrees with that footboard. Scoot out just a little bit. Like that. Okay? The first thing we're going to do is take the protective strip that's provided in the casting kit. This is placed about a ½ an inch above the crease here of the first and second toe. So right there. You can have the patient hold the top. And I've got some tape. I'm going to place the first piece of tape. It's right at the ankle joint. Just hold it in place. I'll put another one here real lightly. Another one up the leg, like that, to hold that in place. The next thing that is done is the plastic cutoff tube is applied. This is placed about a ½ an inch from the end of the black strip and taped into place as previously done, alternating it over the strips that were placed to hold on the black protective barrier. This will move around a little, so you have to make sure that it ends up being held in place properly. You might need to reapply the tape, like that. You put on your gloves. The next thing is a very important step, and that's putting a plastic bag over the patient's leg. This must be done whenever using the SDS sock, or it can result in some major problems because the material will stick to the skin. So the bag goes on, pull it all the way up like that. Next thing then is your sock. There's a little tear off piece here. You can open that real easily. Just open the bag. Take the sock out. It's also wrapped in some foil here. Just take this off. It can be discarded. You unroll it about 3 inches or so. You can see where there's a seam at the end where you can line that up just like your normal sock would be. Also stretch it out. This is water activated, so as soon as you dip it into some lukewarm water, you want to get it soaked real well. You can wring out some of the excess water, but not much. Stretch it out. Have them lift up their foot. This gets placed over so the seam, goes at the end, and you can see it like that. And you unroll the sock on over the heel. And you unroll the sock all the way up the leg. And I'm making sure there's no wrinkles in it. I'm not pulling on it too tight so that it crimps up the toes. You can place your foot down on the board. Just unroll this until it's completely up. Like that. Take note of where the cutoff tube is. And you're going to want to wet your gloves real good and start massaging this material in. You get inside the medial longitudinal arch real well. And now once this is on, now you have to start paying attention to make sure you've got everything lined up properly. So you'd have the patient scoot out a little bit in this case, just so we can get everything lined up at a 90-degree angle to the floor with the heel, knee, foot, all at a proper angle. In the meantime, you're just continuing to massage the material in to get it wet. You can't use too much water, because water is what activates the material. It'll feel a little bit warm to the patient. All along you're just watching, making sure the alignment stays neutral like you want it to. You can feel bony areas here, navicular and the malleoli. Just mold this material around it real nice like that. So once the material's been on for a few minutes and starting to harden up, you take your scissors from the STS scissors and cut just a little starter hole at the bottom of that cut-off strip, like that. Okay, so you'll be able to get your scissors into that hole to cut this off with. Then you can take the white tubing and just gently pull that out, like that. The black strip is still there to protect the patient's skin, and now there's a tube that's left an opening so you can cut it with the scissors. I actually like to take the pencil that comes with it and draw some lines perpendicular to that line, so that when I go to line the cast back up, once I cut it off, I can line that back up. If you wanted to, you could also trace on down where you're going to be cutting. Also at this time, you can go ahead and palpate like the apex of the medial malleolus, kind of delineate that, navicular. Maybe the first med head. And then move on over, same with the other side, the lateral malleolus. If there's a prominent base of the fifth, you can just make those marks on the outside so we can know if there's any areas that need to be relieved. You're then able to insert the scissor into the hole, and these are curved up so it goes away from the body, but you want to be pulling up so that you don't put any undue pressure on the patient. And just start cutting up that channel that's left. You can cut down this way also. Just keep making your way until you cut this all the way through. I'm pulling away towards me as I'm bringing this on up the leg. Like that. And you have the box, the bag. Open that up. As you pull this apart, you can have the patient lift up their foot. And just kind of rotate this a little bit, twist it off like that. So now you can see how the cast can line these lines back up again. It's formed, it's a good representation, there's no wrinkles. My landmarks are on there. You can either leave the bag in there or you can remove it by simply just pulling this out. Like that. You'd want to write the patient's name on there, possibly your facility name. You can write it on the bottom, on the sides. But this is ready to go. Something else you can do though, however, just to better mark where there's a potential problem area. Say like you wanted to mark the medial malleolus. You can place the tape over that. Place the tape over it, take a Sharpie, and just really color that in. You could use lipstick also if you wanted to. Like that. Take your sock that you took off and your scissors and cut on down towards the toe, just to leave a wider opening. Open this back up, have them slide their foot in there, like that. And then just press in that area firmly so you can feel where that is. Take this back off. Now you'll be able to see inside the cast where that mark is at. You could then better delineate that if you'd like to with an ink pen or the Sharpie. And then that'll transfer over to the lab so they'll know where that area is at if that was an area of concern. This just comes off. There's no mark on the patient's skin, nothing's been touched to them, so if there's any skin issues or wounds or anything like that, this is very clean and neat, and nothing comes in contact with the patient other than the plastic bag. There's your cast. Okay, so you've worked hard, taking your time, and you've gotten a perfect cast. How do you make sure now it gets to us in good shape so we can make a good brace for you? Well, first of all, it's always a good idea to write the patient's name and your facility name somewhere on the cast so we can identify it. Take some paper, you can wad that up, stuff it into the cast section opening there just to make sure that stays filled out. You don't want to forget your completed work order form. And put that underneath the rubber band, like that, so that stays secured to it. Take some bubble wrap. You can wrap the cast up in that. You just place it in the box, seal it up, and it's ready to go. It'll arrive to us in good shape, and we'll be able to make your brace for you.